Scan 9.2. Inserting an oropharyngeal airway. 1. Ensure the oropharyngeal airway is the correct size by checking to make sure it either extends from the center of the mouth to the angle of the jaw, or measure from the corner of the patient's mouth to the tip of the earlobe. 3. Use the cross fingers technique to open the patient's mouth. So it looks like our fingers are like this. Insert the airway with the tip pointing to the roof of the patient's mouth. Rotate it 180 degrees into position. When the airway is properly positioned, the flange rests against the patient's mouth. After proper insertion, the patient is ready for ventilation. Note: monitor the patient closely. If there is a gag reflex, remove the airway adjunct at once by following the anatomic curvature. You do not need to rotate the device when removing it. Nasopharyngeal airway. The nasopharyngeal airway has gained popularity because it often does not stimulate the gag reflex. This allows the nasopharyngeal airway to be used in patients who have a reduced level of responsiveness, but still have an intact gag reflex. Other benefits include the fact that it can be used when the teeth are clenched and when there are oral injuries. Use the soft, flexible nasal airway and not the rigid, clear plastic airway in the field. The soft ones are less likely to cause soft tissue damage or bleeding. The typical sizes for adults are 34, 32, 30, and 28 French. To insert a nasopharyngeal airway, follow these steps in Scan 9.3. Measure the nasopharyngeal airway from the patient's nostril to the tip of the earlobe or to the angle of the jaw. Choosing the correct length will ensure an appropriate diameter. 2. Lubricate the outside of the tube with a water-based lubricant before insertion. Do not use a petroleum jelly or any other type of non-water-based lubricant. Such substances can damage the tissue lining of the nasal cavity and the pharynx and increase the risk of infection. Inserting a narrow nasopharyngeal airway. Measure the nasopharyngeal airway from the patient's nostril to the tip of the earlobe or to the angle of the jaw. Apply a water-based lubricant before insertion. Gently push the tip of the nose upward and insert the airway with the beveled side toward the base of the nostril or toward the septum, which is the wall that separates the nostrils. Insert the airway, advancing it until the flange rests against the nostril. I'm going to read this one again. Gently push the tip of the nose upward and insert the airway with the beveled side toward the base of the nostril or toward the septum, which is the wall that separates the nostrils. Insert the airway, advancing it until the flange rests against the nostril. Never force a nasopharyngeal airway. If you experience difficulty advancing the airway, pull the tube out and try the other nostril.